What has COVID-19 taught us about Canada's healthcare system?
Well, we were just talking about that. I think that we're very lucky in that we have a lot of access to information and we're able to get the vaccinations when we need them to be given to us and we don't have to pay for them. I think for the most part, I think we're very fortunate and I think they've done a really good job.
That it is vulnerable, that the number of beds, the urgent care beds, per head of population is lamentably low. Canada comes towards the bottom of the list. It's the same in the United Kingdom as well. Other countries such as Germany are much better provided for. They've got, the problem is the sort of approach that if you don't need something right away, then you get rid of it just in time. It's all very well for products on the shelves, but it's not good enough for emergency care, which at any moment can be necessary. And so if there's unused wards with beds nonetheless that can be used, then so much the better. And then there's the personnel, and that's the other problem, particularly in Quebec, but even here in Ontario. It's making sure we've got the staff, that the staff are decently paid, and that, you know, they're given the support that they need.
It's a tough situation. We've had, cases where things have been delayed and, family doctors being off sick or, staff off sick. It's been a difficult time, and obviously having investment into the healthcare, because they're really people that really worked out very long and hard hours for us, and having limits like the 1% that the Ford government does, we both don't. We're not agree. For that,
No. And we know firsthand the effects of it because he was waiting for a surgery for cancer and it was postponed. He was lucky enough he had it, but postponing it was a lot of stress on us.
That we are desperately underfunding our healthcare systems and that a lot of the restrictions that we've had lately would not be there if we had more better funded healthcare systems that could handle taking care of more Canadians.
Our healthcare system's been broken for years now, and instead of putting any actual funding into healthcare, they just spent it all on COVID benefits and COVID vaccines and an overstock of them. So I think the money could have been more well spent on actual healthcare.
I think we've got a fantastic healthcare system, and it's had our back our whole lives. It's been here for us this last couple of years, and I think it's going to continue to be there for us. It's a good system.
It's been a problem for years and years and years and years. They're not putting money back into infrastructure. They're not putting money back into nurses, the heroes. They're not putting money back into doctors. Where are they putting it? They're not putting it into hospitals.
I think it was shaky to start with. Wait times for surgeries and even getting blood work done, you go up there and you wait 3 hours, right? I think that we need to invest more in that than anything else. I think that if the hospitals were able to take more people quicker, then we could ease the restrictions. So to me, this isn't about like the public or whatever. This is about funding of healthcare. If I felt good that, if I did get sick, I could go to the hospital and be taken care of quickly, I'm okay with that. Even with my mom, knowing that she could go in and get treatment and not be forced to sit in a hallway or possibly not even get in, right? That's what I'm concerned of. So I think if we put more money into healthcare, we could open up quicker.
That they need to start focusing more money on that, focus their efforts on that instead of policing people trying to live a normal life. Maybe they should spend the time in Parliament figuring out what's wrong with our healthcare system and why our healthcare system can't support a virus that, for the most part, has the same symptoms as a cold or a flu, why that brings the healthcare system to its knees and we have to live this way. So they should start focusing on that instead of fining truckers for coming to peacefully protest, that sort of thing.
Definitely it needs work. We all know that. I don't think there's anybody here that's going to say it's great. You can compare us to the States, but it's apple to oranges, right? Our free healthcare system compared to a paid healthcare system. I believe in free healthcare. I think it definitely should be a priority to maximize. I think people's safety is #1 priority, and the healthcare I think definitely should be improved. And I think the COVID-19 definitely illustrated that we need a lot of work.
It's never been adequate, especially in New Brunswick. New Brunswick healthcare is really poor.
Well, as compared to the U.S., it's terrific. And I mean, our death toll is about 1/3 of what the U.S. have experienced. So you have to say our healthcare is very, very good.
Maybe one thing to criticize is that it didn't reach everyone with the vaccinations. If more people would have been vaccinated sooner, this would have been over already. So I think for everyone it's getting a bit tiresome that this situation is dragging on, and it wouldn't have been necessary if more people would have been vaccinated earlier.
We've found all kinds of holes in it. Like one of the things was Canada was not prepared for this at all. One of the things that has of course came out only a few months later was that they actually destroyed a whole bunch of masks and stuff just a few months before, and we didn't. And there was a committee or a group that was supposed to look after this, and I think they were disbanded like in 2018 or like a year before. So Canada was not ready.
And I work in healthcare, senior care, and I think our healthcare systems stepped up. They were awesome.